All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets, and it's 9:02. So we're going to get the show on the road. Welcome. It is August 14th, and we are here to improve the lives of our community with affordable healthcare. So thank you for being a part of that mission, and thank you for being here because open enrollment is coming close. All right. So AEP is coming up here in about 2 months to the date here. And then we have open enrollment for ACA, individual and family plans. We're going to talk a little bit about that this morning, and that is coming in November 1st. So it's all about preparation right now, making sure that you get your certifications done, making sure that you're getting your book of business in order, making sure that you have a marketing plan all set up so you can have a successful and amazing AEP. More important, it's really about making this thing enjoyable, right? I know I talk to a lot of you guys and you guys get really stressed out about AEP, and it really shouldn't be that way. And I think the reason why is because maybe we don't do enough preparation. Maybe we don't do enough marketing ahead of time. Maybe we are not as organized as we need to be. Okay. Don't let October 1st sneak up on you, because that's pre-AEP, and that's when you can start marketing the plans. You can start talking to your members about these plans. You can get them all the way to the finish line except taking the app, right? You can do a full presentation. You can do scope of appointments. It is a selling season from October 1 to October 14. So with that said, we're actually less than 2 months away. So think about that, right? And if you are really struggling with organization, if you're struggling with marketing, if you're struggling with a game plan, if you're struggling with organizing your book of business and getting it in order to make sure that you retain the members that you've struggled so hard to get, please do not hesitate to reach out to us. Please reach out to us. We are here to help you. Okay. I don't want you to get through AEP and say, well, didn't work out for me. Guess I'll see you in January. You know, that's not what this is all about, guys. I want to make sure that everyone here has a successful AEP, or at least a more enjoyable one. Okay. So we've got lots and lots of tools, lots of resources here, and we're going to talk about that this morning. So let's dive in. Remember, guys, we have to have one foot in the classroom and the other one in the field at all times, so we can educate and take care of our members and our community. So with that said, we've got some cool things happening this week. Things are starting to pick up again with the events. Now keep in mind that recertification is most important. So if you haven't gotten all of your carriers recertified, please make sure you do that. Why? Well, if you're earning a commission or you expect to earn a residual on the people that you enrolled, the only way that you're going to get paid is if you recertify for each of those carriers, okay? Well, Justin and I only have like 2 members. Okay, well, both of those members are next year going to be over $300 for the year for Medicare. On ACA, it's anywhere from $25 to $30 a month. So is recertification for those 2 members worth it? Let's see, $600 for maybe spending an hour in certification? I don't know. For me, it's worth it. That's up to you. All right, think about that. Now, let's jump in here. This morning, we got a busy morning. Ultimate Health Plans here in Florida is doing their rollout. There's 2 rollouts happening today, one in the morning at 10 a.m. and the other one in the afternoon at 2. So if you want to make one of those, Ultimate Health Plans is going to be rolling out their 2024 benefits today. You can join that virtually. The register link is on the training calendar. Remember, guys, if you don't have the training calendar, please shoot an email over to support@askhpm.com, and we're glad to get you that training calendar on your devices. Also at 2 o'clock today, you got United Healthcare doing their MedSup rollout as well. So if you're interested in working the MedSup market or you need an update, check that out today at 10 o'clock. United Healthcare is doing their virtual office sessions. So if you have questions for United, that's at 4 o'clock today. They're also doing one later in the week, Friday at 3 o'clock. There's nothing like ending a week by talking to United Healthcare, right? So they're there if you have any questions or concerns. Moving over to Tuesday, Orlando Market Care Plus is doing their rollout session tomorrow, 9:30. Kind of a last minute jaunt here for the Orlando market, please check your emails, because these carriers in your market, whether you're in Orlando or somewhere else, your emails are going to be super important to get these invites from the event. It'll have instructions on how to register. Thank you to Tom for putting all this together. But tomorrow, CarePlus is doing their rollout session for 2024. That's at 9:30 at the Rosen Plaza Hotel. So if you're in the Orlando market or you're nearby, it might be worth the drive. That's at 9:30. They're one of the hottest plans in Florida. Humana is the #1 seller here, so you might want to pay attention to that one. Tomorrow, the 15th at 11, Devoted is doing an open training session. So any questions, no matter where you are in the Devoted journey, you can jump in there. Devoted is a hot product and very important to health plan markets. So we expect everyone to know and hopefully contract with Devoted, because they are the fastest growing Medicare Advantage plan in the country. Fastest growing Medicare Advantage plan in the country. It is true. So even if they're not in your area this year, you might just want to pay attention to Devoted, because they are on a hot streak. Moving over to Wednesday, we've got our very own Al Clancy available for a virtual coffee and chat session. This is BYOC, bring your own coffee, but you can join Al Clancy. And again, guys, value, right? You have your own personal insurance coach. This guy will take you from zero to hero. I don't see enough people taking advantage of Al's time that he's put together. 9:30 on Wednesday. I don't care if you've been in this business 20 years. I can guarantee you a steak dinner that Al will teach you something. I can guarantee it. And when you learn something, you earn a little bit more, guys. That's how it works around here, okay? You have your very own insurance coach. So thank you, Al, for making yourself available there. That is on Wednesday at 9:30. It is virtual, so wherever you are in the world, you can just click that link and he'll be available on the Google Meet. There you go. Also on Wednesday the 16th, Devoted is still doing their rock and roll sessions. This is their 2024 benefit rollout sessions that they're doing across everywhere, really. So we've captured the Florida, because we have, quite a few folks here that do Devoted in Florida. This one is in Lakeland. They're doing one at 10 a.m. at Lake Crago Recreation Center, and also at 2 o'clock. So those two events are in the Lakeland area. 11 o'clock on Wednesday, Cigna's got their virtual office sessions. So if you have questions about Cigna, they are a focus carrier for us too. We really need help with Cigna. They need our help, and they're an excellent national carrier, and they are willing to invest in your marketing. Ding, 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 willing to invest in your marketing. Pay attention to that. We'll talk more about that later on. Also on Wednesday, utilizing Spark on the go. As you may know, we use Spark's platform for our Medicare Advantage and Medicare Supplement business. This is your CRM, and it is available on your phone. So I know many of you, like me, are on the go quite a bit. And so you want to be able to use your Spark platform while you're on the go. There's a whole training on that. That is on Wednesday at 2:30 to 3:30. It's about an hour, and a fantastic little thing that they've got going on there. Also on Wednesday, Devoted, another rock and roll session, this time for Daytona market. They're relatively new to Daytona. I think this is year 2 for them. So Devoted in Daytona, that's at 4 o'clock. And that looks like that's at the Twin Oak Garden, wherever that is in Daytona. You can check that out. Also at the same time, we're doing, that's an internal meeting. We'll talk more about that. Thursday, the 17th, we've got another Devoted rock and roll session. This one's in the Jacksonville market. The River Club is there in Jacksonville, so you can check that out. Another enroll session there. And then last training for the week is Friday, the 18th. UHC is doing another MedSup rollout, this time at 2 o'clock on Friday. So that's the training for the week. Remember, guys, one foot in the classroom and the other one in the field at all times. That's what it's all about. Okay, as a reminder, we have our tee-off happening September 22nd, and we are going to send out official invitations very shortly. But if you want to get a jump skip on this, we only have about 90 spots left. I know 10 of you have already RSVP'd. We're holding 100 folks for this particular event. So if you want to hold your spot, September 22nd from 3 p.m. until who knows when, I'm hoping we have so much fun that it goes all the way until 10 o'clock. You can register for that event on the training calendar, but it is there on the Luma in our chat session. So if you're interested, you can go ahead and jump in and save your spot now. Okay, remember, we're only going to hold that spot for 100 folks. We've got 90 seats left. And then we're going to be launching official invitations. If you want to wait for your invitation, that's a-okay. Just know that if you set it now, you're good to go. Already got one more this morning, so happy to see that we've got another person, 11 there. So 89 seats left to go on that. So there it is. Now, this morning, there's been some updates to the CMS guidance. So I want to talk a little bit about that. This past week, Cigna has sent up an update about the CMS updates. And I want to talk about this because I know a lot of you are getting confused, not really sure where to go for compliance, for questions that you might have. So I want to read this email to you and make sure that everyone understands. If you have questions, please let us know. We are here for you. All right, so Cigna sent this last week. Important CMS updates. Please carefully review the information below to stay in compliance with CMS guidelines. The Center for Medicare and Medicaid Services, CMS, recently released several important updates, including the 2024 final rule that may impact you. Please take some time to carefully review this information to ensure you stay in compliance with CMS guidelines. So this is not just Cigna, this is everybody, okay? So let's talk about marketing submissions. All right, so CMS announced new marketing review time frames that went into effect on July 24, 2023. So this was last month. CMS announced this. Sales presentations will remain a 45-day review. And so if you're doing sales presentations or you're designing sales presentations, they are going to be in a 45-day cycle. Now, keep in mind, we already have a Medicare one-on-one presentation I'm going to talk about in just a little bit. And in that catalog that I'm going to share with you, you can order your very own presentation. Okay. Telephonic sales and enrollment scripts will change from a 45-day window to file and use. So again, if you're doing enrollments, the carriers are going to give you a telephonic enrollment script. So more to come on that. Radio advertisements or shows will change from file and use to a 45-day review. So what that means is if you're doing anything on the radio, you've got to send it in 45 days in advance for them to review before you can go live with any radio advertisements if you're doing that. Provider office materials provided at a provider's office will change from file and use to 45-day window. Now we have some pre-approved pieces we're going to talk about today and in the next calls in the next coming days, okay? And as a reminder, all TV advertisements that are considered marketing must be filed in HPMS under a 45-day review. So unless you've got big bucks, you don't have to worry about the TV ads. TV ads are very expensive. So let's talk about TPMO reporting requirements. This is mostly for us as an FMO, but I do want to make sure that you guys are aware. Per CMS final rule released in 2022, third-party marketing organizations are required to report subcontracted relationships and issues of noncompliance to Cigna. So if we see something out there, we have to let Cigna know or any carrier know that there's been some bad behavior, right? To facilitate the reporting process, we have created the templates linked below. That's in their producer university. Requirement 1, disclose any subcontracted relationship to Cigna Healthcare. The completed template must be sent to Cigna. So that is there. And then requirement 2, disclose compliance violations to Cigna. and then they've got a template there. So just keep that in mind. You know, we're not here to bust anybody, but if you have questions, please let us know. I don't want to have an issue because we are required in order to keep our contract with Cigna to report any violations. Now, if you see a violation outside of our group, or you see another agent doing something they shouldn't be, like cold calling or door knocking, we can help you file that and we can go up the chain for that. All right, now let's talk about the enrollment process because this is going to affect you guys immediately. There's a lot to go through here, so I'm going to read pretty quickly here, okay? So the requirement outlined below applies to all plans and TPMOs. CMS has published its 2024 final rule. The final rule announces changes to existing marketing and communication requirements for both Medicare Advantage and Part D plans. These changes strengthen beneficiary protections and improve MA and Part D marketing. The 24 final rule takes effect on September 30th and applies to all marketing and communications that occur for the contract year of 2024. This includes any marketing occurring October 1 and later, and any communications that are distributed for 24, regardless of when they are distributed. So the overview of the changes. Enrollments. Agents/brokers must explain the effect of an enrollee's enrollment choice on their current coverage. The effect on current enrollment will be added to the pre-enrollment checklist, the PECL. The PECL must be reviewed with beneficiaries as part of all enrollments. Now, if you're using SHOP, Medicare SHOP to do your enrollment, that is in there, okay? But the idea here is, hey, by joining this plan, this will automatically disenroll you from your current coverage, if that's the case. Or if you're on straight Medicare, by enrolling in this plan, you will remain on Medicare, but receive your benefits through Cigna, as an example. Okay, so it's very important that you explain their effect on their current coverage. Agents and brokers must cover a list of required elements prior to enrollment, including provider availability, costs and premiums for prescriptions and healthcare coverage, benefits, beneficiaries' specific healthcare needs, and the beneficiary's current medications. Guys, I have great news on this. If you use our SHOP enrollment platform, step by step by step will automatically cover you for compliance. Just use the enrollment and you're covered. It's amazing. Again, we're going to be hosting trainings weekly on SHOP, hopefully coming this week. All right. Scope of appointment, SOA, and business reply cards, BRCs. Agents/brokers are not allowed to go to a beneficiary's home unless it was scheduled for that date and time. An agent or broker showing up unannounced is considered unsolicited contact. Beneficiary contact is limited to 12 months following the date that the enrollee first asked for information on either the scope or the BRC. So they're extending it. You get a year to touch those members and continue to market them until you get an appointment, okay? A 48-hour window between the receipt of a scope of appointment and an agent meeting with a beneficiary is required. Inbound calls do not need to have a 48-hour time frame prior to discussion of products. This is a big one, guys. Inbound calls do not need to have a 48-hour time frame prior to discussion of products. What this means is that, yes, you still have to have a scope of appointment, but you can do it immediately on the phone. Now, remember, if you're using SHOP, you can capture the scope by emailing it to them, texting it to them, or doing it verbally over the phone, okay? Or if you're at an event or whatever, you can capture it on paper, right, and then upload it, okay? And so if they call you, let's say you do a postcard mailer or whatever, you were doing an event, they grabbed your card and then they called you, you can do the scope of appointment immediately and start discussing benefits and do the enrollment if that is needed, okay? So this is amazing. All right, exceptions include beneficiaries initiated walk-ins, Okay, so if you have an office or you have a marketing place that you go, or if you're at a tabletop or you have a place that you are constantly at and somebody walks in and says, hey, I'm interested in talking to you about benefits, you don't have to wait 48 hours. Okay, transportation requirements of the beneficiary. Beneficiary is within 4 days of the end of a valid election period. So at the end of the month, if they have an SEP, you don't have to wait 48 hours if you're within the 4-day window. AEP, OEP, or ICEP, all of those are valid at the end. You don't have to wait 48 hours within the 4 days. So let's say the end of the month, August 31, it's August 29. You don't have to wait 2 days. I can get them in, get the scope and get them enrolled immediately. Okay. Let's talk about events. Collection of scope of appointments and or setting up a future marketing appointment at educational events is prohibited. This is a change from last year. You cannot collect the scope of appointment at an educational event. You can collect a reply card or permission. Okay, this is important to remember. All right, a marketing or sales event cannot occur within 12 hours of an educational event at the same location. So let me talk a little bit about this. Some people were getting smart and they were doing a Medicare 101 and they said, hey, come back in an hour and I'll tell you all about Cigna. And then that's a sales presentation that they filed. You can't do that anymore. You have to wait 12 hours, which is essentially a next day. Okay. So you can't do a sales presentation within 12 hours of just doing an educational. Okay. TPMOs, that's us. The call recording requirement are limited to sales and enrollment calls between TPMOs and beneficiaries. For example, a call to a beneficiary to confirm an appointment does not need to be recorded. So last year, every interaction, CMS said every interaction had to be recorded. Remember, calls you, hey, I couldn't get my messages, or I couldn't get my medication. You got to record it. Hey, my doctor said I was ugly and I can't read good. Got to record it. All of that stuff is now gone. So if you know that you're calling to discuss sales, or you know that you're calling to discuss anything at all, then you need to record that call when it's in the enrollment process, okay? CMS reiterates the requirement to record calls, including virtual connections such as Zoom and FaceTime. Audio portion only must be recorded. If a beneficiary does not want to be recorded, the call meeting conference must end. So that means you have to go see them personally if they do not want to be recorded, okay? In all advertising, the marketing names of TPMOs must be displayed in the same font as contact information. Okay, so they must see that, you know, this is Health Plan Markets or this is you doing what you're doing. TPMOs must update policies, procedures, job aids, and telephonic scripts as applicable. The TPMO must modify the TPO disclaimer to add state health assistance program as an option for beneficiaries to obtain additional coverage and include the number of MA organizations and products the broker represents in the service area. We've got that covered. I'm going to talk about that in a minute. The TPO disclaimer must be stated verbally. The disclaimer must be stated verbally within the first minute of your call, or electronically conveyed when communicating with the beneficiary through email, online chat, or other electronic means of communication. If the disclaimer is pre-recorded, it must be read at the same pace as the contact information. Okay? The disclaimer must be included in any marketing materials, print, television, and prominently displayed on TPMO websites. Again, we're going to talk about this because we have marketing materials that are already pre-approved and have the disclaimer on it. So it's really easy that you say, hey, I like that one, and copy, paste, repeat. Put your picture, name, phone number, email, whatever you want on it. It'll be there for you. All right, revised disclaimer for TPMOs that do not sell for all MA and or Part D plans within a service area. So if you don't have every contract, which is very likely you do not, you have to have this on your website if you have a website, or you have to have this on your marketing materials. And so the disclaimer reads, we do not offer every plan available in your area. Currently, we represent X number of organizations which offer X number of plans, products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program SHIP to get information on all of your options. Now, if you do offer every single Medicare plan in that area, there is a second disclaimer that you can use, and it says, currently we represent X amount of organizations which offer X amount of plans, products in your area. You can always contact Medicare.gov, 1-800-Medicare, or your local SHIP for help with plan choices. Okay. Moving on to marketing materials that include the Medicare card image. We talked about this. This is an update on the card. CMS now requires that all materials that card be approved via a review process separate from the marketing material review process. Below is CMS process that should be followed for the review of materials that include the Medicare card image. So they're saying you can use the Medicare card, but it must be approved, okay? Send an email to CMS marketing mailbox at cms.hhs.gov with a copy of the material that has the Medicare card image on it. An email must be sent for both marketing and communication materials, okay? CMS will provide the approval or disapproval when filing marketing materials in HPMS. The approval email must be included in the material that, when submitted, in a zip file that includes the material ID of the marketing pieces. Okay, don't worry about this, guys. If you have a piece and you want to get it submitted, just send it to us at support@askhpm.com. We're just making sure that you're clear on the steps here because it's not going to happen tomorrow. It takes some time. Medicare is reviewing all of these pieces, so it's really, really important that we do that. For TPMOs only, CMS also requires that agencies add a disclaimer in the vicinity of the Medicare card image that indicates that they are not affiliated or endorsed by CMS, HHS, and the federal government, etc. A missing disclaimer near the Medicare card image may indicate that the approval process was bypassed, resulting in additional follow-up by the reviewer. It's just going to delay the process, okay? Lastly, multi-plan marketing material reviews. This is if you have more than one carrier on a specific piece, business card, flyer, event, whatever that looks like. CMS requires that all marketing materials are reviewed by plans prior to CMS submission. Cigna Healthcare is developing an intake tool to manage this process, which will be released later this month. In the meantime, please submit all marketing materials to your broker manager or account manager as appropriate, okay? So if you have devoted Cigna and Aetna on one piece, then it needs to be submitted to each of those carriers, okay? And then they'll send it up to CMS for approval, okay? That was a lot to unpack. I know it ate up a lot of the call, but some of these are good news, but I wanted to be crystal clear on the new updates for Medicare marketing and guidelines so we don't have a boo-boo out there this year for AEP. All right, so we have some questions in the chat, so I'm going to stop here. Will is asking, how is CMS dealing with random telemarketing companies who are contacting clients and transitioning to other carriers? So there are call centers. Call centers are not going to go away. It depends on how these people are being contacted. So, some folks fill out a form online. Some of them call a TV ad. Some of them respond to a newspaper or direct mailer. Those are all ways that the majority of these people are being contacted. That's the right way to do it. However, if you're coming across a specific telemarketing company that's cold calling without permission, then that is illegal, and you should encourage your member to report them to Medicare, okay? If you find a trend, please let me know, or you can send an email to support@askhpm.com and we'll escalate it, okay? John is adding, scope of appointments done over the phone need to be done on a recorded line, correct? Yes, that is correct. It has to be recorded as well. So if you're doing your scope, now remember guys, if you're doing a scope of appointment, you're in the sales process, you're in the enrollment process. So you should have started the call with the disclaimer and you should have hit that record button right away, okay? Now, if you're using Ring Central like we recommend, You can set it up so your Ring Central automatically records every call as it comes in. If you don't have Ring Central, we highly recommend checking it out. Just shoot us an email, support@askhpm.com, and we'll get you connected on how to get a Ring Central account. By the way, we are moving away from the recorded feature on Shop because only 2% of you are using it. So unfortunately, it's very expensive, and we are highly recommending that you use Ring Central or some other alternative. If you have questions about it, please let us know, and we're happy to help. All right. Thank you, Angie, for confirming that. Will, why are there such stringent requirements for brokers, but the CMS is whom our direct contractors are given passes? They advertise via their websites. Well, the rules are the rules, Will. I can't answer for CMS, and I can't answer for the bad apples out there. Like I had mentioned before, these rules apply for everyone that are selling Medicare Advantage and Medicare supplement plans. These are CMS updates. So again, if you see something, say something, or encourage your folks to escalate it to CMS. We're not going to catch all the pirates, but if you spot a pirate, you can definitely report them, okay? Again, you have that ability to do that, or you can escalate it to us, and we're happy to take that off your plate, and we'll pass it on to the carriers, especially if it's carrier specific. If we see some bad behavior and it's, they're representing a certain carrier, then just let us know, and we're happy to track that down, okay? Elisa, so I'm gathering we need to know how many carriers we are appointed with and how many plans that carrier uses. That is right. Absolutely. If you plan on doing marketing and having a disclaimer on your marketing, yes, you will need to have that information available. That should be easily available on your shop. We'll go through that on the next call on how to identify how many plans you currently are ready to sell for, and how many carriers you're ready to sell for. I'll show you how to cross-check that on Shop. I think it's a great opportunity to do that. And then John, I know you're on the call. Maybe you can take a note on, maybe we can create a scribe or a loom, so that way folks know how many plans you sell for. Making a note here. Thank you, Elisa, for that. And absolutely, we'll show you how to do that, but it's in your shop and you should be able to see what that goes to. All right, Mary, TPM cold calls at least 17 times a day. Computer calls, therefore phone number cannot be called back to catch them. They use Medicare in their name. Yeah, that's a bummer. I know exactly what you're talking about. Again, if you have the ability to capture a phone number or play along for a moment so you get the name of the organization or a callback number, that would be very helpful. Unfortunately, like I said before, we're not going to catch all the pirates. Some of these organizations are outsourcing these telemarketing companies, and they're overseas. So that's why it's really, really hard to catch a lot of this telemarketing that's happening. Yes, CMS is punishing telemarketing, and we are kind of in the path of their rage right now, because we are considered external brokers and agents. So that's why it's become a little bit difficult for us to do our business. But if we follow the rules and regulations, really not that bad, guys. Okay. All right. Stan, I think it's Stan here. As a T65 myself, I get these unsolicited calls to me personally all the time. Yep, I know. So again, if you can grab information from them, play along, get enough information so we can go ahead and escalate it to either the carrier, if they mention a carrier, or to CMS directly, and we're happy to help on that. Yeah, Will, you mentioned competitors. We talked about that. Maria Turk, how can I get a copy of the CMS updates you outlined? Absolutely. In fact, I think there's a link on the Cigna. Here's the final rule. And I'm going to copy the link here. It might be a long one, but I'm going to post it in the chat. You should be able to click that, and it takes you to Federal Register, and you'll see the full summary here. I'm going to put it up on the screen. So there it is, and it talks about the final rule that we had just talked about in super amounts of detail. So it looks like there are over 600 pages of this document. Hallelujah. But if you're interested, you've got that there. All right. Eric says, when I get a call from telemarketing, I usually pretend I want to sit down with an agent in person, and I grab the agency name and the contact that way. Thank you. That's exactly how you catch a criminal, right? So Catch a Predator, or whatever that TV show is. Yeah, if you want to play along, I think that's going to be super helpful for you to grab the information so we can stop these pirates when we have a chance to. Again, we're not going to be able to catch them all, but if you're out there and you see something, say something. Okay. Sergio is reminding us, FYI, pre-ordering period begins Monday, August 14th for 2024 AEP sales materials for WellCare. So if you are wanting physical kits, many of you, when you completed your certifications, have the option to go ahead and do some pre-ordering there. I know Humana allows you to do that. I know that WellCare, so today WellCare is releasing the ability to order kits, physical kits. I know some of you have offices, or maybe you just prefer to have them on hand. You are more than welcome to do those pre-orders. I highly, 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 highly recommend that any pre-orders that you're taking now, get it done today or get it done very soon, because there's going to be a backlog of kits. Let me remind everyone, we will not be hosting kits. We will not be storing kits. We will not have any kits available at Healthland Markets for the sake of the earth, okay? We have HPM Shop. We have Medicare Shop, HPM Shop, and it has everything you need in the enrollment platform. It is 100% compliant. However, if your members are requesting a kit, you can always send it to them. But if you prefer, like I said, it is up to you to order your own kits. If you need help ordering kits, we are happy to help you order the kits, but we are not going to be storing kits. Please do not call our team and ask, hey, I need a Cigna kit immediately. We will not be able to help you. We will refer you to a Cigna broker manager in your area. And those are the folks that are going to be driving around like Ubers and dropping kits all over the place. Happy to connect you with those folks. We will not be storing kits because we have a fantastic enrollment software system that has it baked in there. So again, it's up to you to order your kits. Make sure that you have them on hand. We're not going to be storing them for you. Okay. Maria, Mary, thank you. You are very welcome. Very happy to help here. One last thing here, WellCare usually automatically sends out a variety of sales kits. That's fantastic. Yes, some carriers will auto send some kits out to you based on production. Or if you're new, they'll probably send you a couple of kits. I know Freedom used to send a couple of kits automatically. But if you don't get what you need, maybe they send you some kits, but not all the kits, or maybe you see a certain plan that you didn't get enough of, go ahead and get into that pre-order and order up. Those of you that are going to the first looks, this is your ability to kind of gauge what plans are going to be hot this year, what plans you think your members are going to want, okay? And stock up on those kits, get them pre-ordered, get those physical kits on hand, so that way you have them when you need them, okay? If you wait until October 1st and you're looking for kits, yeah, you're probably going to be waiting a while for it, okay? I'm telling you here on August 14th, more than 2 months ahead of time, that you need to have kits on hand. If you want kits on hand, it is not required. You have it in shop. You can download it. And also when your member enrolls, it's automatically sent to them via email, and you can text it to them as well. So all of that is in shop. Fantastic. Great session, guys. We went a little bit over time here. It's 9:40. I appreciate everyone's time and attention. I hope everyone has a fantastic week. As always, we're here to help. Give us a call, 844-696-3975. Please call if we haven't talked to you in a while. We love you. We want to take care of you. We want to make sure you got everything you need. Or send us an email at support@askhpm.com. Thank you guys for everything that you do. We wish you the best of luck.